Want to let you know that. We'll get you right back in when proceedings continue. Meantime, we have a special guest, an anesthesiologist with us, Dr. Raphael Gershon, and he has some equipment to show us. And Doctor, one of the things that is so big in this case is how was this administered to Michael Jackson? It seemed the normal way was to inject it with, syringe injection and then the drip that would keep him under. Is that the norm or not?
No, it's not the norm. We have a syringe pump, and I brought in a syringe pump with me today. But there's not a whole lot that's happening in this case that's a norm. You have to use, there's a very tight dose response with propofol. That is to say that you could give a little and get sedated, you could give a little more and you completely stop breathing. And that's under the closest observing by a trained personnel anesthesiologist or an anesthetist. That's not what's occurring here. There was no monitoring going on. There was no syringe pump. This drug is given in a microgram per kilogram per minute dosing. You can't give this drug with micrograms, small amounts, very individualized dosing in a patient without a syringe pump. You could give a larger dose, expecting the person to stop breathing, and that's what we do in the operating room. If we want to maintain an infusion in the operating room, we're going to use a syringe pump. There's nothing special or fancy about this syringe pump. It's actually quite old. We have much smaller and much more advanced. But at the end of the day, you have to put in the kilogram of the patient. You have to individualize care. You have to know what procedure is occurring, what is the operating procedure. It's certainly not in the bedroom.
Yeah, absolutely. And when you just mentioned just a second ago, monitoring. What we've been told through court is that there's been a pulse oximeter used, a little device, plastic device you put on a finger with no alarms. There's no way that's proper for propofol, right?
Well, I don't think you mean proper. I think you mean adequate. I think Dr.
Right.
Murray definitely gets points for using a pulse oximeter, but you can't leave the room because there's other things that can occur. A pulse oximeter is measuring your oxygen saturation in your blood, not to get too technical, but if your respiratory rate drops or if your airway, quote-unquote, closes down, your carbon dioxide is going to build up, and that's also going to affect your myocardial function. And it all sounds like a lot of hocus pocus, but the bottom line is he's not trained to do this.
Mm-hmm. That's so key. One other question I have for you here, and it's been danced around a little bit, whether or not Michael Jackson could have actually drank the propofol. What would happen to somebody if they drank the stuff?
Well, I've been asked that before, so my two answers are basically, I don't know, I never drank it, and I don't know anybody else who ever drank it. But my guess is if you drank it, you would probably throw up. And certainly, I just don't believe that's what occurred. We saw the coroner's report and the tox report, I think because they saw possibly some of it in stomach blood or the blood that supplies the stomach. The blood goes everywhere. If there's propofol in the blood, it's going to also be in the blood that supplies the stomach. Especially on top of that, if Michael Jackson has been using propofol so regularly, he knows that drinking it's not going to do anything for him. It needs to be given intravenously.
Hey, real quick. Oh, we're about ready to head back into court. Do you think that whatever was set up may have malfunctioned, Raphael?
Explain that again?
Whatever IV drip may have been set up, do you buy the prosecution's theory that could have been malfunctioning and that's why more than what should have been put in his system went in there?
Well, I think that sounds like more what a defense would say, but at the end of the day, you still shouldn't be doing it. So you should count on the fact that it may malfunction.
Period.
You should count on the fact that you're going to give too much. You should not be doing it. That's one of the reasons you shouldn't be doing it.
Got it. Dr. Raphael Gershon, we appreciate your expertise. Let's get back into court. Morning break over here in Los Angeles.